Rhinosinusitis is inflammation of the nasal cavity and the paranasal sinuses. The term rhinosinusitis is preferred over sinusitis because inflammation of the sinus cavity is almost always accompanied by inflammation of the nasal cavity. In Ayurveda, having freshly prepared and easily digestible warm food, lots of vegetables and fresh fruit is advised. Taking warm water, plain, or prepared with cinnamon and black pepper is also recommended. Eat plenty of garlic and ginger. Avoid cold, heavy, oily foods, cold drinks, chocolates, ice cream, and cold water. Get plenty of rest. Sleep while lying on one side with a pillow beneath your head. This prevents the accumulation of mucus in the air passages and helps to avoid difficulties in breathing. In traditional Chinese medicine, excessive consumption of greasy hot foods can lead to phlegm and heat, and it may predispose one to sinusitis. This type of food can lead to the formation of damp heat in the stomach and the spleen, and this may be carried to the sinuses via the stomach. It should be noted that dietary and lifestyle changes can be difficult for some patients to adopt. In Western medicine, the clinical diagnosis of acute rhinosinusitis is challenging due to the overlapping of symptoms with other ordinary childhood nasal diseases, such as viral upper respiratory tract infections and allergic rhinitis. Acute rhinosinusitis is one of the most common infections of the upper respiratory tract, and it affects a significant proportion of the population. For adults seeking care in an ambulatory medicine practice, sinusitis is the most common diagnosis, and it's treated with antibiotics. Serum vitamin D is associated with patients with chronic rhinosinusitis. It was shown that there was a significant association between lower levels of vitamin D and chronic rhinosinusitis, especially in chronic rhinosinusitis with nasal polyps. You can get a 5-hydroxy vitamin D blood test to assess your levels and then supplement accordingly. Vitamin E is a powerful antioxidant, and it can calm portions of the immune system that are involved in allergic reactions. Cod liver oil is high in vitamin A and D, and these are natural anti-inflammatories to reduce the inflammation of the mucous membranes. Vitamin C also reduces inflammation and allergic responses. Several studies suggest that bromelain, an enzyme derived from pineapple, can help to reduce inflammation and swelling and relieve symptoms of sinusitis. Bromelain is the proteolytic enzyme obtained from the pineapple. Its physiological effects appear to include interactions with inflammatory, immune, cell signaling, coagulation molecules, and related pathways. The enzyme's anti-inflammatory action is due to its inhibition of bradykinin production at the inflammatory site. For sinus problems, quercetin has also been found to stabilize the cells in the body that release histamine, the chemical that stimulates mucus secretion in the sinuses. A beneficial effect of probiotics for nasal disease is suggested by a clinical trial of the probiotic Lactococcus lactis W136 in patients with chronic sinusitis and with or without nasal polyps who were unresponsive to treatment despite previous sinus surgery. In addition to relieving COPD and bronchitis, NAC can help to improve other lung and respiratory tract conditions like cystic fibrosis, asthma, and pulmonary fibrosis, as well as symptoms of nasal and sinus congestion due to allergies or infection. With herbs, eucalyptus has been shown to have anti-inflammatory, antiseptic, and decongestant properties, and it's traditionally used to treat asthma, nasal congestion, runny nose, coughs, sore throat, and sinusitis. A mix containing extracts of 5 herbs, the elderflowers, primrose flower, common sorrel, European vervain, and gentian can also help. The flowers of the black elder are mucolytic. The active substance of the cowslip and the calyx are also mucolytic, and they have anti-inflammatory activity and combat the cause of the disease, namely viruses and bacteria. The leaves and stems of common sorrel act as mucolytic agents, and they have anti-inflammatory effect. The leaves and stems of verbena also act as mucolytic agents and have antiviral activity. And gentian root contains substances with mucolytic action. The treatment goal includes maintaining open drainage and decreasing inflammation. A herb or a mixture that would have a combined effect of being antimicrobial, decongestant, immune system stimulating, and mucolytic would be of the most benefit. Echinacea extract displays anti-inflammatory activity in virus-infected cells. With golden seal, the sinuses and the throat and the mouth and the urinary tract are all subject to infection, as well as the intestines and the vaginal walls. Golden seal can treat those infections because it has antimicrobial properties that are ideal for fighting and preventing these type of infections. Golden seal is referred to as nature's antibiotic because of its antibacterial and anti-inflammatory properties. Golden seal's benefits are often attributed to berberine, the active ingredient. Therefore, berberine hydrochloride may be the most reliable option for the quality and the effectiveness. The stinging nettle has been used for centuries as a remedy for allergic rhinitis and many other ailments. Modern freeze-drying apparently concentrates the compounds that soothe the inflamed nasal passages and the sinus. Some other commonly used herbs are the immune-boosting herbs, ginger, garlic, echinacea, elderberry, olive leaf, oregano, calendula, and astragalus root. The demulcents, they're substances that relieve irritation of the mucous membrane in the mouth by forming a protective film. These are licorice root, marshmallow root, cinnamon, plantain, and fenugreek. And the herbal decongestants, peppermint, spearmint, eucalyptus, ginger, oregano, and thyme. Chronic sinusitis is linked to recurring deep-root sinus infections. Some methods of fixing this are nasal irrigation with salt water or nascent iodine or colloidal silver.